Many people still assume that diabetes can only be confirmed through laboratory blood work. A visit to a clinic, a sample sent for testing, and only then does the diagnosis appear. That belief is common, and it has persisted for years. In clinical practice, over more than 20 years, a different pattern becomes clear. The body often begins signaling elevated blood sugar long before any lab report confirms it. One of the earliest places these signals appear is the feet. The reason for sharing this is the number of individuals who arrive at medical care only after symptoms have been present for months or even years without recognition. Some come during routine examinations. Others arrive in emergency situations. In many of them, early warning signs were already present but went unnoticed. One recent case involved a 67-year-old retired man who considered himself generally healthy and reported no major concerns. During a routine evaluation, attention was first given to his feet. He mentioned a persistent mild numb sensation that he assumed was simply a normal part of aging. Further assessment revealed that he was already showing multiple indicators from a set of 9 warning signs. His fasting blood glucose measured 214. He had been living with diabetes for more than 2 years without awareness of it. This example reflects a broader reality in which a significant portion of individuals with diabetes remain undiagnosed. Estimates from the American Diabetes Association suggest that 1 in 5 people with the condition are unaware they have it. This represents more than 8,000 individuals. While the condition progresses quietly, it gradually affects nerves, kidney function, vision, and the feet. However, early detection is possible, and even a low-cost blood test around $12 can identify the problem before severe damage occurs. Before laboratory confirmation, the body often provides clues. One of the first warning signs involves tingling or numb sensations in the feet, often described as a pins and needles feeling. Many people dismiss this sensation as temporary nerve pressure from sitting or posture. But when it occurs repeatedly without a clear cause, it may indicate early nerve damage linked to prolonged elevated blood sugar. This condition is known as peripheral neuropathy. In this process, excessive glucose begins to damage the protective covering of nerves. These nerves function like electrical wiring, and when their insulation deteriorates, signals between the brain and feet become distorted. The result is abnormal sensations such as tingling. According to the American Diabetes Association, nearly 50% of individuals with diabetes experience peripheral neuropathy, making it one of the most common complications. It usually begins in the lower extremities. A simple preventive habit often recommended is daily walking for 20 to 30 minutes. Regular movement helps maintain circulation to the feet. At the same time, reducing added sugar intake is strongly advised without delay. Another important sign appears at night when discomfort becomes more noticeable. Some individuals describe a burning sensation in the soles of the feet, especially when lying down to rest. While occasional fatigue or overuse can cause temporary discomfort, persistent burning pain during rest hours may indicate early diabetic nerve involvement. In this condition, damaged nerves begin sending incorrect signals to the brain, creating a false perception of heat. The nervous system behaves as if an alarm is malfunctioning, triggering alerts without an actual external cause. This internal misfiring creates the sensation of burning even when no physical heat is present. Research published in Diabetes Care has shown that burning foot pain may appear 1 to 3 years before an official diagnosis of type 2 diabetes in many cases. Supportive daily habits include maintaining adequate hydration of about 8 glasses of water per day and increasing dietary fiber intake through vegetables, legumes, and oats. These changes help slow glucose absorption and support metabolic balance. A third critical warning sign involves slow wound healing on the feet. Small injuries that normally resolve within days may remain open for extended periods. This occurs because persistently high blood sugar damages blood vessels, reducing circulation. As a result, oxygen and immune cells cannot efficiently reach injured tissue. Without sufficient blood flow, even minor cuts or blisters may fail to close properly. The process becomes delayed and vulnerable to infection. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, exceeding 1,000 cases annually. Most of these severe outcomes begin with small wounds that were not recognized or treated early. If any cut, blister, or broken area on the skin is noticed, it should be washed using gentle soap and water. An antiseptic should then be applied, followed by a protective covering. If there is no visible improvement within 48 hours, medical attention should be sought without delay, not postponed to the following week. The fourth sign appears in a way that is often overlooked because it is visible every day. Many individuals pass by it repeatedly without recognizing its significance. The change is observable, yet rarely connected to blood sugar levels. Some people notice that their feet begin to show darker or more reddish tones. It is often dismissed as normal skin variation, sun exposure, or long-standing pigmentation around the ankles. However, there is a distinct pattern of color change that can appear around the ankle region when circulation is reduced. When blood sugar remains elevated over time, blood flow to the lower limbs becomes restricted. As a result, oxygen delivery to the skin decreases. This reduced oxygen supply can lead to darker shading, deeper red tones, or even a slightly bluish appearance near the ankles. These changes indicate that circulation is not functioning properly in that area. In some cases, the skin in these regions becomes thinner and more fragile. This reflects reduced nourishment reaching the tissue over time. To explain this clearly, blood functions as a delivery system transporting oxygen and nutrients throughout the body. The feet are located at the farthest point of this system. When blood vessels become narrowed due to prolonged elevated glucose, the delivery process slows. The skin in the lower extremities begins to show visible signs of reduced oxygen supply. Research published in the Journal of the American Academy of Dermatology found that these types of skin changes may be observed approximately 18 months before a formal diabetes diagnosis. A supportive daily routine for this condition includes about 5 minutes of ankle rotations, toe lifts, and calf stretching in the morning. Even small movements help stimulate circulation to the feet. When activity is not possible, slightly elevating the feet while seated may also assist blood flow. The fifth sign is often underestimated because it appears harmless and familiar. Many individuals experience it for years without linking it to blood sugar imbalance. It is commonly described as heel dryness or cracking, often assumed to be seasonal skin dryness. While this can be true in many cases, persistent or severe cracking that does not improve with moisturizers may indicate a deeper issue. Elevated blood sugar can affect the autonomic nervous system, which controls automatic body functions. One of these functions is the regulation of sweat and moisture in the skin. When these nerves are damaged, sweat gland activity in the feet decreases. This results in reduced natural moisture, causing the skin to dry from within rather than from external factors. Because of this internal loss of hydration, external creams or lotions often fail to resolve the issue. The skin barrier begins to weaken, and cracks develop over time. These cracks are not merely cosmetic concerns. They can become entry points for bacteria, increasing the risk of infection, especially when circulation is already reduced. In some cases, individuals report severe heel fissures that bleed and persist for long periods despite continuous use of moisturizing products. This suggests an underlying nerve-related problem rather than a simple skin condition. Medical associations, including the American Podiatric Medical Association, recognize persistent heel cracking as a possible indicator of autonomic nerve dysfunction in older adults, often associated with long-term elevated blood sugar. This condition reflects significant stress on the nervous system rather than a minor irritation. Daily care recommendations include applying moisturizer or natural oil, such as coconut oil, to the soles and heels each night. However, moisture should never be applied between the toes due to the risk of fungal growth in trapped humidity. Adequate hydration is also important, with an intake of approximately 8 glasses of water per day to support skin function from within. The sixth sign involves swelling in the feet and ankles and is more serious because it may indicate broader internal changes beyond the lower limbs. Some individuals experience mild swelling due to prolonged standing or sitting, which can be normal. However, consistent swelling that leaves marks from socks or pressure indentations can indicate a different condition. Long-term elevated blood sugar can affect kidney function. The kidneys are responsible for regulating fluid balance in the body. When kidney performance declines, fluid is no longer efficiently filtered. This leads to accumulation of excess fluid in the lowest parts of the body due to gravity, particularly the feet and ankles. This condition is known as edema and reflects strain on the body's filtration system. The kidneys function like a purification system for the bloodstream. When they are damaged, fluid regulation becomes impaired, and buildup occurs in dependent areas. A common visible sign is pitting, where pressing on swollen skin leaves a temporary indentation. This is considered an important clinical indicator. Data from the National Kidney Foundation indicates that diabetic kidney disease affects approximately 1 in 3 adults with diabetes. Swelling in the lower extremities is often one of the earliest visible signs of this decline. A practical measure includes elevating the feet slightly above heart level when resting to assist fluid return toward the central circulation. Reducing dietary sodium is also important, as salt increases fluid retention and worsens swelling. If swelling appears suddenly, persists, or worsens over time, medical evaluation is recommended promptly. The seventh sign is frequently misidentified, especially among men. Many individuals live with it for extended periods while attributing it to other causes. A common pattern is persistent foot pain, managed with over-the-counter anti-inflammatory medication. It is often assumed to be related to joint strain, arthritis, or past physical activity injuries. Many individuals describe experiencing foot pain and turn to common anti-inflammatory medication for relief over long periods of time. They often believe the cause is arthritis, past physical strain, or old sports injuries. There are cases where this assumption is correct. However, there are also situations where the source of pain is entirely different, and standard medication provides no real solution. When chronic elevated blood sugar damages nerves, the nervous system does not always become silent. In some cases, it becomes overly active. Instead of reduced sensation, the nerves begin generating uncontrolled pain signals that reach the brain. Patients often report sensations described as stabbing pain, electric shock feelings, or a burning needle-like pressure in the foot. These symptoms are most noticeable during nighttime when external distractions are minimal. It can be compared to a damaged vehicle alarm system that triggers repeatedly without any real threat. The alarm continues to sound even though nothing is wrong externally. The system itself is malfunctioning. In the same way, damaged nerves generate false danger signals. The pain is real, but the origin is nerve dysfunction rather than physical injury. Standard anti-inflammatory medication does not repair nerve damage. Instead, it may reduce the perception of signals while the underlying issue continues to progress. A major study published in the New England Journal of Medicine reported that painful diabetic neuropathy affects approximately 25% of individuals with diabetes. It is frequently misidentified as arthritis, tendon inflammation, or age-related joint discomfort. A commonly recommended routine includes gentle morning foot and ankle movements lasting about 5 minutes before standing up. Activities such as foot flexing, ankle rotation, and gentle toe stretching help stimulate circulation before weight is applied. At night, gentle massage using light circular motion along the sole and up the ankle is often suggested to support comfort and blood flow. The eighth sign indicates a more advanced stage of progression. When this sign is present, it often means that vascular and nerve changes have been developing for a longer period of time. Many individuals report that they have always had cold feet and consider it a normal personal trait. Others mention needing additional blankets or heated coverings for many years. However, concern increases when cold sensations persist, regardless of environmental temperature. Feet remain cold even during summer or under multiple layers of insulation, while the rest of the body feels warm. This pattern suggests reduced circulation in the lower extremities. Blood vessels may have narrowed or stiffened to the point where warm blood does not adequately reach the feet. Blood circulation functions like a network of heating pipes distributing warmth throughout a structure. When these pathways are restricted, the farthest areas receive insufficient heat, regardless of overall system effort. The American Heart Association reports that peripheral artery disease affects more than 8,000 people in the United States. Diabetes is identified as the leading risk factor for this condition. Persistent cold feet are considered one of its common early indicators. One recommended response is daily brisk walking for approximately 30 minutes, or starting with 10 minutes if necessary. This form of activity encourages blood flow to the lower limbs and supports vascular function over time. The ninth sign is rarely discussed and often goes unnoticed, even in medical settings. Many individuals do not recognize it until it is pointed out during a physical examination. It involves a noticeable reduction or complete absence of hair on the lower legs and the top of the feet. Hair growth requires a consistent supply of oxygen and nutrients delivered through blood circulation. When circulation is reduced due to long-term elevated blood sugar, hair follicles gradually receive less support. Over time, these follicles stop producing hair. This results in visible thinning or complete loss of hair in affected areas. Hair follicles can be compared to plants dependent on steady irrigation. When the supply line narrows, growth slows and eventually stops entirely. This lack of hair growth becomes a visible indicator of underlying vascular changes that may have been developing for years. Research published in Diabetes, Obesity, and Metabolism found a strong correlation between lower limb hair loss and peripheral vascular disease in individuals with diabetes. It is recognized as an important but frequently overlooked clinical sign. A simple self-check involves observing the lower legs and tops of the feet for reduced hair density or complete absence. When this sign is present, medical evaluation of blood glucose levels is strongly recommended without delay. Across all 9 signs, the consistent message is that early physical changes often appear before formal diagnosis. Many individuals only recognize these signs after progression has already occurred. A final recommendation is simple observation. Before sleep, examine the feet carefully, including skin condition, between the toes, and any unusual sensation or wound. Even a brief daily check can help identify changes early enough for effective management through lifestyle adjustments and medical consultation. If any of these signs are present, prompt medical testing is strongly advised. Early awareness allows for better control through dietary changes, daily movement, and professional guidance. This awareness is essential for maintaining long-term health, independence, and mobility. Taking early action can significantly reduce future complications. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.